Dr. John Mendelsohn of Advanced Cosmetic Surgery and Laser Center will be performing a facelift on me.
Tomorrow.
Just like he did Jenn Jordan.
Same thing.
We have him on the phone. Good morning, Dr. Mendelsohn.
Good morning, Jeff and Jen. How are you?
Doing good.
I'm good.
Good.
I'm ready.
Jen, I've been
following your progress, Jen. You seem to, I know I'm going to see you tomorrow. Sounds like you're making a nice recovery.
Oh, and I look good too, don't I?
good. Well,
you always look good. Yeah, I was a little bit concerned for a moment there.
You have a follow-up tomorrow while Jeff is
Friday,
there, too?
actually.
Oh, I was going to say, how
Friday,
fun.
sorry.
Yeah, I'm popping in.
You guys are taking appointments together now.
I know. I might be there. Let's schedule it so I'm there at the same time because you got to see Jeff the day after to take off all of the bandages and stuff.
I do, and we could, if you'd like that, we can adjust that. I know, well, I'm not sure when you're on, Jen, so I think right now it's around 10:30. We'll accommodate you however we need to.
Fun.
Yeah.
That would be fun.
So
yeah.
People are constantly asking questions, and because this topic of conversation has come up in the past, who do you find coming to you more often than not for this type of procedure? Is it, mostly like middle-aged people like me who are looking to tighten things up a little bit, or are you getting more and more young people? Like, what would you say is your biggest demographic right now?
Yeah, that's a really good question. I think you guys know in Rookwood we're celebrating our 25th year anniversary, and so things have changed a lot over the past couple of decades. When I first started, I think the typical patient was, we probably see 80, 82% female to male, first of all. But I don't think that's changed a whole lot. As much as we're seeing more and more men, we're also seeing more and more women. And the typical age was probably 55 to 65 back then. Over the years, I think the 50th birthday became a big trigger for people in a lot of ways, just reflecting they're ready to take care of themselves, they've taken care of the family, and so forth and so on. These days, we are seeing, even here in Cincinnati, we're starting to see younger patients as well, and it's not because they're crazy or they're obsessed. It's because patients even in their 40s are seeing, genetically, they're seeing changes in their jawline, their jowl, their neck. And the way I see it is, when we grew up, we were supposed to use sunscreen, right? Of course, we're using baby oil and we're burning our skin and doing all of those things. These days, if you look at our kids, they're coming in for treatments like Botox early, prejuvenation, right, to prevent those wrinkles even in their 20s. And I think that this whole thing is sort of an extension of health, wellness, skin care, and taking care of yourself is a lot of what we're seeing. So, Jeff, that's a really good question. We are seeing a younger decade, probably from when we started, that really enter this area. And we're talking about the lower face, but eyelids start even sooner, often in patients' 30s, and that's often a genetic predisposition anyway. If you throw a little aging in there along the way with our eyelids, then obviously that becomes more and more common even into our 40s. But yeah.
It was funny. I was out last night, and people who I see they're looking because they know what I've gone and done, so they want to check it out. And I had a woman say to me, she goes, she says, you look like you, just with a really good filter on you. And I'm like
that.
I like that too, because I think that's a fair description, because it's still very clearly me.
Yeah.
You did not change at all my appearance. It's just like you put a really nice filter on the picture.
Yeah, that's accurate.
Yeah. Yeah.
Yeah.
I think the idea, I was just going to say, I think the idea with these procedures, with these, quote, aging face procedures are to look more refreshed. Patients are coming to us and they feel like they look tired. Everybody's running around. Jen, you certainly are running around, constantly. And but we are, we're working hard. But when I think when COVID came and patients started to see themselves on Zoom more, I mean, where else at a time in society do we look at ourselves more between social media and being on Zoom? And I think that was a real trigger. People want to feel more confident. They want to feel like they look refreshed. And really, that's the goal of what we're doing. We're not trying to change somebody's appearance. You walk into a restaurant and somebody's, saying, oh my God, what did he or she do? We see all those people. We see more of those people probably in South Florida and probably out in, LA perhaps. But we do want patients to look natural, and yeah, it's a refreshing procedure.
I know that for me, I lost over 50 pounds 5 years ago. And, we've heard the term Ozempic face, like for people who lose weight really rapidly and they want to pull up some of that extra skin and extra flesh. That can happen even for someone who didn't go on a GLP-1 and just wants to tighten things up a little bit, which is one of the reasons I do it. And, we're in a relatively public job, so I'd like to put my best foot forward. But Jamie Lee Curtis, the actress, was talking about younger people getting facelifts, and it was her opinion that, you shouldn't do it when you're too young. If you want to tighten something up when you're young, I mean, is this something you can do more than once
when
if you
does
decide?
Your face stop changing? Like, yeah. Like, when is your adult face in place?
Yeah, well, there's a lot there. Let me comment first, though, about this Ozempic face or just weight loss in general. So for decades, I think we did a Cincinnati extreme makeover back in 2003 on a patient. Her name was Marlene. She had lost almost 200 pounds, maybe through gastric bypass or banding. Patients do lose, hundreds of pounds just through dieting. These days with GLP-1s and, people lose weight. And when we get to a certain point, we lose that elasticity in our skin, and so it doesn't snap back. If you do that perhaps at a pregnancy when you're in your 20s, the tissue often snaps back. That's good elasticity. We don't see that, so we end up with this extra tissue. And Jeff, for you, yeah, you've had a huge weight loss journey. You look great already, and it's just an opportunity here to clean things up. And I do think that you'll be pleased and look more refreshed. And that is a very common trigger for patients that we're seeing. With regards to age in general, it's true, as we age, we lose more elasticity. Too young. Well, first of all, we want to make sure there are two things that we're solving when patients come to see us. Number one, there's a problem we can identify and something that we can see in a before and after. This doesn't mean it needs to be like, wow. It means if you've got a jowl or if there's extra eyelid tissue or a bump on your nose or whatever we're doing. So there needs to be a problem that we can all clearly identify. And the second thing is that patient needs to have a desire to change that. And so Jamie Lee Curtis might be right if patients are coming in just because they're seeing some trend on social media and they want to jump on it because for whatever reason they're getting behind or their friends are doing it. So those are probably the wrong reasons. Doing it for somebody else is not the right reason. But for most of us, if we start to see changes, and just like I said earlier, and we want to feel more confident and fix these problems, then age isn't always the determining factor.
Angela's asking if there's such a thing as a mini facelift. Like, what if you're at a point in life where you don't feel like you needed, a drastic change, but you're just looking for maybe
just
a little,
smidge.
Yeah, a little tuck here, a little nip there. I suppose it just depends on the individual, I would imagine.
Yeah, so when I first started here in Cincinnati in 1997, we did many educational seminars. And so the way that I would often start the seminar off, I would ask everybody to sort of raise their hand when they could identify and tell me what a complete facelift was, okay? So I would ask, does it address the skin on the upper part of your eyelid? Does it address the bags in your lower eyelid? Does it address your jowls in your neck? Does it address the bump on your nose? Does it address your torn earlobe, right? We're getting a little bit ridiculous because hands are going up, people are nodding, people are confused because it's very confusing to understand exactly what these terms mean. And so if you go for a facelift somewhere else, this is back in the day, what are you doing? Are you addressing your brows or not? Okay, versus today. So we explain very carefully what our procedures are solving. So for both of you, when we do an upper blepharoplasty, upper eyelid procedure, we're rejuvenating the upper eyelid. That's pretty clear. If we're doing what we call an advanced lift, that's not very clear, but we do define it as the folds, jowl, jawline, and neckline. So we're breaking down that complete facelift from this everything, whatever we do, to specific anatomic areas. Okay. So the next thing is, in terms of that term mini, and we used to actually call this a mini lift because back in the day, and still now, most facial plastic surgeons are performing this under IV sedation or general anesthesia. We've been doing this under local with that oral, sedation for 25 years. And so there's a mini part to that because generally speaking, we've got minimal issues related to anesthesia because it's local. We generally see less bruising, less bleeding. We don't use tubes, we don't use drains, we use smaller incisions. So what I'm saying is, to some degree, what we're doing has a mini component to it, if I'm really educating and being accurate about what we're saying. Now, if Angela's question has to do with an area like just my jowl or just my neck, yes, there are procedures that we can do to target just those regions if that's really what the problem is. So patients come in, they don't like some fat or skin in their neck area. There are targeted procedures where we don't need to do what we're doing with both of you. I hope that made sense.
Totally. And so in my case, like tomorrow, you're my doctor. I'm going in. We're gonna brighten up the eyelids a little. We're gonna you calling it upper blepharoplasty, but yeah, so that we don't have that sag anymore. And then a full on facelift. Is that what we're doing?
Yeah, well, this is really a lower facelifting procedure. So if we want to use that term, what we're doing in the lower face is a lower facelifting and a blepharoplasty. So we're doing something to the upper third of the face with the eyelids, and we're doing something to the lower 2/3 of the face, jowl, jawline, and neck with the advanced lift. And one of the things, Jeff, depending tomorrow, obviously we're going to take care of you. I didn't do a lot of education for filming with Jenn. We were just really focused on taking care of her. But there are differences between men and women, the position of the incision, the anatomy. So I may be working through that. I might just do it afterward. Again, we're going to take care of you as well. But I do want to point out those differences in terms of designing the incisions and the way that we're moving the tissue and so forth. So I'd call it a lower facelift, Jeff, and then we're doing an upper blepharoplasty. So that's the upper part of the upper third of your face that we're rejuvenating somewhat.
Yeah, and his surgery's probably going to go a little bit quicker because he won't be quite as high maintenance as I am. Wouldn't you say that's probably likely true?
I'm gonna reserve comments right now. I will acknowledge that Jenn, your surgery probably took a little bit longer than we anticipated, but that's okay. We're not rushing through anything. But
to elaborate,
right.
we know what you're going through.
Everybody,
Okay, well,
I try so hard to not be that way, yet it just
Everybody's
happens.
different.
That's how we know Jeff is going to sail through with flying colors because
Well, I don't know about that, but
yes,
fingers
he's going to do
crossed.
great.
Right.
yeah, I think Jeff will do very well. I've worked with Jeff before, but Jenn, you did well also. It's just a little different experience, but we had a good time. So
I'm glad you enjoyed yourself.
I'm excited.
That's right. That's right.
Well, Dr. Mendelsohn, you got any questions for me, your patient?
Well, I do, because you'd typically receive a call here tonight, but if you want to do this now, I do want to know, especially after watching Jenn over the past month or so, but what questions can I answer for you?
Well, you answered most of them. The only thing that we were debating is I asked Jenn, which side, real quick, because I'm pressed for time, but are you going on the front of the ear or going in the back of the ear? The incision.
Where were his going to be?
Yeah, great question. So if you look at Jenn's incision, that little bump on the ear called the tragus, that little cartilage we have in front of our ear canal. For you, Jeff, that's a great question. We're going to be pre-tragus. We're going to make it in front. It's going to be right along the edge of where your beard line is. There's a non-hair-bearing and a hair-bearing area. That's where we're going to make it. That's a great question. That is one of the differences. We don't want to move your beard back into your ear canal. And generally, if we place an incision between a hair-bearing and a non-hair-bearing area, things heal beautifully and no one will see it.
There you go.
Okay,
How
well,
about that?
And Jeff, I know we're pressed for time. I will tell you tomorrow, well, tonight too, I'll call you, but tomorrow we're going to sit down and review everything before we take you back. So we're going to make sure you answer all your questions.
You get the Valiant.
and Kristen wants to know if she can go for a swim while I'm having my procedure.
I think she can. We encourage it.
But she doesn't have to wait around for me, in other words.
No, she doesn't. No, I think she'll be more help later in the afternoon. So no, she can go do her thing.
All right, Dr. John Mendelsohn with Advanced Cosmetic Surgery and Laser Center performing my facelift and eyelid lift tomorrow. Very excited and look forward to seeing you.
Okay, I look forward to seeing you too. Thank you guys. Have a great day. Appreciate it.
Yeah, good luck and have fun.
Thank you. We'll have fun. Okay.
All right, there he goes.
Yeah, I mean, it
can't
is
wait.
cool. He only schedules one surgery a day, so he's not, pressed for time.
I'm the only
That's
surgery.
why I didn't feel too guilty when I found out that it was it didn't feel like 4 hours. Like, I was surprised to hear that I was in there for 4 hours. But yeah, I didn't feel guilty about being so high maintenance because they didn't have another surgery sitting there waiting.
It's like, where else you got to be?
Where else you got?
What else you got going on today?
You sit down and do it.
It's not like the cataract doctor where they line them up.
Right,
It's just
exactly.
one in, one out. One in, one out.
Yeah, I like that a
I do
lot.
too.
If you want more details on what we just talked about, go online, 351face.com. That's 351face.com/Jeff and Jenn.